Hi, my name is Samson Samuel, and this video is titled Globalization of Physician-Owned Hospitals and Learning Through Strategic Alliances. Now, this video talks about physician-owned hospitals and the concept of innovative capabilities inside a hospital to develop new services and innovative behaviors and processes. The physician-owned hospitals were started by physicians who were not satisfied with the traditional healthcare system, and they invested in these hospitals and brought about the paradigm of physician-owned hospitals in United States. These hospitals are specialty hospitals. They cater their services to either orthopedic oriented or neurosurgery or cardiovascular services. These hospitals have set up a brand image in the communities, and their quality of health care and patient satisfaction and patient safety outranks the scores from community hospitals. Several research studies have been done by CMS and also by Press Ganey surveys, which show that these hospitals have improved quality of care, improved patient satisfaction, and improved safety compared to the surrounding community hospitals. The innovation incorporates dynamic capabilities approach, which consists of key processes such as learning, coordination and integration of processes, learning to acquire and assimilate and transform the existing knowledge and exploit the existing knowledge inside the firm, and also set up these skills outside the borders of the United States. The Patient Protection and Affordable Care Act that was passed by President Obama's administration has put a lot of restrictions in terms of growth and spread of these hospitals. This took effect immediately after the law was passed, and the existing hospitals, physician-owned hospitals, were grandfathered. And these restrictions paved a setback in the growth of these hospitals, and the concept of spreading these hospitals across the borders of the United States is the innovative concept, and will help in growing these hospitals outside the United States. The physician hospitals have to find a target, a hospital or a healthcare organization outside the United States, either in developed or developing countries, and do the due diligence inquiry and form an alliance, either a joint venture or acquisition of these hospitals outside the United States, and set up a hospital that will provide an effective service for a global citizen and in the communities outside the United States. Now, as we know, the current economy is global, and there are many countries where people don't have immediate access to quality health care, and providing these services by setting up a joint venture or a acquisition of hospitals will provide a quality health care to global citizens. This will also increase the market share of physician-owned hospitals, both in the United States and also in abroad, and increase the human capital and social capital that is important for growth of an organization. This concept of globalization of physician-owned hospitals requires a careful due diligence inquiry, complying with the local and international laws, and one will provide an increased market share for these hospitals in the long run. Driven by these regulatory pressures in the United States, lowered advances in medical technology, physician-owned hospitals should expand outside the United States and provide a social entrepreneurship services and also increase market share in global communities. I strongly believe in this concept, and hopefully the current healthcare law will be decided in the Supreme Court as far as the constitutionality of this law. But for the time being, this law is putting a lot of restrictions on physician-owned hospitals, and therefore an innovative approach by globalizing these hospitals will help these hospitals to increase their market share, grow, and expand their services. Thank you.